Hi, my name is Chris Guanche, and I'm a digital media specialist at NSU's College of Psychology. And welcome to Shark Chats. I'm pleased to bring you our guest today, Dr. Amy Ellis, who is an clinical assistant professor at the College of Psychology and assistant director for the Trauma Resolution and Integration Program. Welcome to Shark Chats.
Thank you so much, Chris. I'm happy to be here.
So before we get into our topic, why don't you just tell me a little bit about your professional background?
Sure. So I'm actually a graduate of Nova Southeastern University. I got a PhD in clinical psychology. After that, I took a little brief adventure up to Boston for my predoctoral internship at Harvard, and then couldn't stay away from Florida, came back down here and have been working in a variety of contexts: academia, private practice, clinical supervision, and research. So most notably really been working on sexual trauma. I try to focus on underserved populations. So males in the field of sexual trauma, often underserved, as well as sexual and gender minorities, people of the LGBTQ plus community. So that's where a lot of my clinical and research work has focused.
And what drew you to this area of research?
Ooh, well, trauma in general was really born out of my love for the Trauma Resolution and Integration Program, which is where I did a practicum placement for several years. Trauma has just always spoken to me. It's incredibly pervasive in the community, much more common than we all kind of think, often because it's not talked about. It's a little bit taboo. And just kind of understanding how those early experiences with trauma impact people later on in their lives and are often perhaps some of the most resilient, just admirable, blossoming individuals is an inspiration. So whatever I can do to kind of focus on understanding their trajectories, trying to help them, trying to figure things out, and then also harnessing that potential, I just gravitate towards it. I love it. I love this community.
So tell me a bit about your current research and what that entails.
Yeah, so I've got a couple things going on. I've got a grant right now with Dr. Joan Cook up at Yale University. It's through PCORI, the Patient-Centered Outcome Research Institute. And we are looking at, it's very niche, we are recruiting male or masculine identifying individuals with a history of unwanted sexual experiences who also identify as LGBTQ+, gay, bisexual, trans, queer, men who have sex with men. And we're really looking for ways in which to engage them in mental health treatment, decrease their depression and anxiety, other sort of mental health outcomes. So we're doing a randomized controlled trial of motivational interviewing. And we've got a couple different components with that, but using MI as a way to harness their strengths and really empower individuals to focus on their values and getting their behaviors to line up with that to achieve the goals that they want to work towards that might improve their lives. So there is about a 6-week curriculum that's run entirely by peer leaders that we've trained for about 30 to 40 hours. The peers run these groups for 6 weeks with 6 to 8 participants. And then the really cool thing is that we jumped on that telehealth bandwagon before it was in fashion. So our research has continued with like 0 hiccups because we've been online for the past year. So pretty nifty.
Now, tell me a little bit about participatory research and what the benefits of that are.
Yes. So our study is using community-based participatory research, or CBPR. Basically, it's a way of reducing the hierarchy between the researcher and the participants. If you think about it traditionally, you've got like the researcher in their white lab coat, they approach the participant, they kind of give a survey or they do an experiment on. It's really not transparent at all. CBPR dismantles that and says, hey, we want to invite our participants, our population of interest, to have a seat at that table. And so everyone has the same seat. It's a circular table. Nobody's at the head of that. And the research is constantly informed and re-informed over and over and over again. So as an example, the whole way that this project got started was we held focus groups with researchers, with actual male sexual abuse survivors. And basically we're like, what do you want? Like, what do you want us to do? What do you wish the research had? How do we address this better? And so based off of those focus groups, that's where this study came in. And then we've iteratively updated it. So our peer leaders are part of our team. They tell us what's working, what's not working on the front lines of those groups. We have an advisory board of survivors, professionals, and then survivors and professionals, people who identify as both. They're constantly giving us feedback. We're soliciting their feedback. So it's always changing, which is cool from like a ground level. And sometimes it can unnerve people who are, traditionally think of research, develop your hypothesis, conduct experiment, done. But the field is growing and really incorporating populations because they have the knowledge that we just don't have. So it's awesome. Love it.
So going to the heart of your research, what are some of the statistics in terms of sexual abuse experienced by men or masculine identifying people?
So in general, 1 in 6 men will be abused before their 18th birthday. And then it actually increases to 1 in 4, just in terms of lifetime prevalence of sexual abuse. So that's like startlingly high. And really probably on par with what you would expect for women or female identifying folks. And I'll actually be a little bit more clear with my language. It's really men and women. When we start talking about transgender individuals, the rates are actually much higher. So about 50% or 1 in 2 trans individuals are sexually assaulted in their lifetime. Men probably experience sexual abuse on the same prevalence rates as women, but often do not disclose. So we know from one study that it takes men on average 20 to 25 years to disclose their sexual abuse. Stigma, male social norms, fear of being labeled as gay or why didn't you want it? There's a lot that goes into why men don't disclose at high rates as women. So yeah, the prevalence rates are like marginally lower, but probably in reality, they're on par.
Now, regarding that stigma, I've just heard personally as a man, sentiments like it's physically impossible for a man to be raped by a woman, or if a man is having sex with a woman, of course he's enjoying it. So how pervasive and entrenched are these stigmas in the people that you work with?
Oh my gosh, incredibly entrenched. I think what we're starting to see evolve is that there's a disconnect between what you know and what you feel. So there's also like cohort differences. I think older men may have been indoctrinated more in these like stereotypical masculine beliefs of real men don't get raped, real men want sex at all times, women can't rape men. That might be more firmly entrenched. With the younger folks, it's more of a disconnect that like they know it's not true. They know the research, they know the information, but there's something deep inside that's been ingrained. And so you can carry out these conversations of, do you believe this? And go, no. But when you actually start hitting at it, you start to feel the shame and the guilt that's really underlying it of, well, did I want it? Did I do something wrong? Did this make me X, Y, and Z? A lot of people will think that child abuse or sexual abuse leads to being gay, bi, trans. And so there's always these like little doubts that are subtly there because of society at large and the beliefs that it manifests.
Mm-hmm. And I don't know how this factors into that stigma, but it's a very common thing in entertainment or people just making jokes about like men in prison showers. So how does stuff like that feed into the situation?
It's awful because I think what it's perpetuating is that men can only be raped by men. And it completely dismantles the idea that men can be raped by women, which is in fact true. The only times you hear about women raping men are when you're talking about a hot teacher having sex with a student. That's glorified. That's seen as something that you strive for. But the fact is that sexual trauma is whenever there's a power differential or an age difference or any unwanted sexual activity. And so when you look at all of those things, whether it's a teacher, whether it's in prison, all of it's unwanted. All of it is with a power differential. So I think it just kind of perpetuates also this idea that rape only occurs in a violent setting, like a prison shower, when in fact there's often a lot more grooming behavior that occurs. Sometimes it can be confusing to a child. Often sexual abuse is not occurring in an isolated context. There's a lot of family environment issues. There's a lot of other adverse experiences that are going on. So these are kids who might be falling through the cracks and are easy to be perpetrated against. So it's not always as grandiose as the movies make it out to be. That does happen. And there's many other instances where it's slow to develop or it's happening over time. There's multiple incidents and frequency or chronicity.
Mm-hmm. And tell me about some of the issues in this area faced by trans men or people who identify as gender fluid.
Oh my gosh. So trans women actually have the highest incidence of sexual trauma. And that's often, again, coming from the stigmatization of the masculinity. So a trans woman is someone who was assigned male at birth, but identifies as a woman. So as you can imagine, probably for most of their lives, they're being socialized as a male, and the expectations of manhood are being kind of really placed upon them. And so when a man deviates from any sort of masculine normative or ideology, there's pushback. And that's what you see with the high prevalence of victimization against trans women. Rape is not about sexual urges or needs. Rape is about power and control. And so when you see someone deviating from the norms, that's where a lot of the power and coercion and control come in from other people. Same thing with trans men. Slightly different though in that regard with masculinity, because you have trans men who may have, they're assigned female at birth and they may have been socialized as women. And so they kind of hear a lot of the indoctrinated beliefs of being quiet and powerless and helpless. And then as they embrace their gender identity of being a man or expressing themselves as a man, they kind of have to readopt these beliefs of being stronger and more confident. It's such an interesting dynamic of how that socialization process influences your gender identity later on, and subsequently then how you respond to the sexual trauma. For genderqueer and non-binary people, as you're pointing out, well, that just becomes even more complicated, because when people, society can't figure things out and can't place a label on you, that confuses them. People don't like a lack of labels, even though I'd argue whatever you want to label yourself as is peachy keen, it doesn't really matter. So when there's confusion or people can't figure things out, that's often also what perpetuates a lot of the trauma, the victimization, the big T trauma as well as the little t traumas.
And in terms of the trauma experienced by these various populations you work with, how is that being impacted by the coronavirus right now?
It's devastating. There's a few different ways. First and foremost, a lot of the people who are being affected by the pandemic are having to move back home. And that's awesome that that's a resource. And for a lot of SGM or sexual and gender minority folks, they're returning back to an abusive or stigmatizing or unwelcoming environment. So either they've come out and it didn't go well, so now they have to keep their true authentic selves locked up, or they never come out, They were just living their life on the outside and now need to come back home, and they're cut off from their community. They don't have social support. They can't talk to family about who they are. So it's just an incredibly isolating experience in returning home. For those who maybe are lucky enough to still be on their own and haven't lost their homes or haven't lost their jobs, the SGM community actually has a high rate of people who work in like restaurant business and other kind of hospitality. We all know how that's going. So they're at increased risk of contracting COVID by being out there or losing their job as restaurants shut down. So the unemployment rate and the homelessness that was already ultra affecting that community is now just increasing. This is also a community that doesn't have access to medical care. And so I don't even know what the latest numbers are, like thousands upon thousands of dollars just to get pandemic related care. People who are not able to pursue other medical surgeries, so like top or bottom surgery for trans individuals, that's all been halted because the hospitals just can't handle it, or maybe can't handle it with the guidelines in place. So it's just been a whirlwind of effects on the community.
Imagine you also have a lot of people who may be kind of stuck in a relationship with an abusive partner, and because of this just don't have the means for getting out of that.
Yes, great point. So intimate partner violence, or IPV, we've actually seen an influx of that across the trauma community. So this isn't even exclusive to LGBTQ plus folks, but just people in intimate relationships. They've seen like upticks in the number of calls placed to abuse hotlines. But as you point out, the SGM community has increased rates of IPV much higher. Bisexual women actually have the highest incidence of IPV, but bisexual individuals in general have really high rates of IPV. And so what's happening is that these are folks who either have to stay with their abusive partner for financial reasons, or really too, they're just kind of stuck in this cycle of intimate partner violence based off of just like the confluence of things kind of affecting them. So high in general within trauma community, extra high in our SGM population.
Mm-hmm. And given where we are now with the coronavirus, just this kind of never-ending uncertainty about how it will develop, how does that compound the trauma that people are experiencing right now?
There's no end in sight. I think when we're working with trauma, we think of post-traumatic stress disorder, right? So you have a trauma, and then there's the period afterwards, and you're struggling to cope with what happened to you before. This is not post anything. This is like concurrent trauma, I don't even know what the term is. And so the difficulty is that there's no end in sight. You can't look for that ray of hope of, okay, I quarantine now, and by August 1st, I'm good to go. I can make it through. Every single time we kind of get a little bit hopeful, the expectations have to diminish because it's like one step forward, sometimes two steps back. All of this can actually bring up earlier traumas that someone has faced, no hope, feeling like there's a lot of secrecy, there's a lot of isolation. So it's bringing up all of those old traumas while currently being traumatized. Mm-hmm. You've got like that double whammy. And as trauma psychologists, we typically work on post-traumatic. We're really not typically working with people who are still in that cycle. The best thing to liken it to would be IPV, where someone might come into therapy, maybe, talking about difficulties in their relationship. They're currently being traumatized. You come up with safety plans. You ensure that someone is safe, and you give them the skills to be safe. You don't actually start processing the trauma that they're going through. That's only going to just kind of bring up those issues again, or those other traumatic symptoms. So not having that end in sight, we're kind of like all just going through it together. And I think it's just bringing up that will this ever end fear that was likely present also in their childhood too.
Tell me a little bit about Male Survivor, the online community.
Love Male Survivor. So malesurvivor.org is it's a nonprofit. It's based out of New York City. They're one of our community partners for the grant, and they have a whole slew of oh my gosh, like I don't know, like 50, 60,000, possibly even more users who go on these discussion forums. It's entirely peer-led, all different subject lines aimed at increasing kind of engagement with the male survivor community. I'll also give a shout out. There's menhealing.org, another one of our community partners. It was founded by Jim Struve. They do these things called weekends of recovery. And so engaging male survivors into these awesome weekends, peer-based support, but led and facilitated by social workers and psychologists and other mental health professionals. And so there's a lot of different organizations that have been developed specifically for male survivors because they're often not seen in the context of sexual trauma. Like you may have seen like #MeToo, and the male movement came out with like #MenToo, because they're often kind of neglected in talking about sexual trauma. So two fantastic organizations.
And tell me about where things are now in terms of your grant research.
We are moving along. So we actually saw a huge uptick in participants because of the pandemic. It seems like people are really craving some social connection. So we just started we're about to start our 14th cycle of groups. So that means 28 groups will have been run within the next month or so. We've had about 120 participants thus far who've been through the groups. We trained 20 peer leaders in year 1, which was last May. We actually just finished up with our year 2 cohort. Welcome to them. So we've got more peer leaders. We're continuing to run groups. Things are going well. Really great recruitment efforts. We've actually been recruiting a lot more through social media, which seems to be the right way to do that. So.
And what would you say are some methods that people can use to not only fight the stigma about male abuse survivors, but also to be an ally to anyone in their lives who may have experienced abuse?
Love it. Couple different things. I would say, first and foremost, survivors should know that they are not alone with those kinds of startling statistics. You might be feeling like you're alone, but you're not. There's an entire community. Chris Anderson, who was former executive director for Male Survivor, always used to give the analogy of imagining like a football stadium and imagine it completely packed. If 1 in 4 men have been abused, you're literally talking about a quadrant of a stadium of male survivors. And so I think that's just kind of a really nice visual of knowing like you're not alone. I would say get involved in some sort of social support. Know that you're not alone. Connect on Male Survivor. Connect with Men Healing. Find a therapist or provider who is knowledgeable, not just in trauma, but male sexual abuse and trauma. The right provider can make all the difference. I think getting connected in those types of forums are probably first and foremost into trying to delve into understanding some of the different impacts of trauma. A lot of the times, trauma survivors grow up, that's all they've ever known, and they just kind of look around at their current life and they think, well, this is how it is. This is how it has to be. Talking to other people gives that perspective of, oh, wait a second, maybe this didn't have to be this way. Not like normal, not normal, but this isn't what I deserved. This isn't how I have to live my life. So struggling with sexual compulsivity or addiction and substance abuse, depression and anxiety, whatever else it may be, knowing that you can get help for those things and that you don't have to live with that, I think is paramount. For people who maybe are not male survivors but want to help, or maybe someone's disclosed, I think it's similar to all trauma survivors. Thanking them, being humble in the fact that somebody has chosen you to disclose to, remaining non-judgmental or blaming, and honestly asking the person what they need or want. Are you looking for help with legal issues? Are you looking for help with practicality of getting out of a situation or avoiding a situation? Are you just looking for someone to, hug and to hold you and to emotionally be there for you? And oftentimes it's that latter one over problem solving, at least to begin with. So just approaching it with open eyes and ears, and then being willing to educate yourself on some of those myths that may permeate folks, I think is first and foremost. Yeah.
Yeah, to your point there, I don't know if this is sort of a societal programming thing, but I feel like a lot of men have kind of this instinct of, you hear someone telling you a problem and the first assumption is, well, what can I do to solve it? And
Yeah.
it's hard to avoid that instinct and just realize that sometimes someone just wants to talk about their problem and they're not looking for a solution. They just want, some empathy and someone to listen to what they've experienced.
It's so true. And we actually at TRIP, we had just started, again, pandemic hit, so not currently functioning, but we had started in the past year a support group for male survivors of trauma. And it was so awesome to see folks come in and have a forum in which to talk, to just get that emotional support. It was like for men, by men, and really focusing on, like, this isn't a problem solving place. We have dialectical behavior therapy skills groups. We have other groups that will kind of target that problem solving or skill development. This is a place to talk and explore and process. And so I think even though the inclination is to problem solve, men, just like women, just like non-binary folks, it doesn't matter what your gender is, we all have that burning desire to feel validated and understood. And so there are resources for that. They're out there.
And on that subject, what would be some online resources you would recommend for people?
Oh my gosh, so many. So Male Survivor, first and foremost, Men Healing, because they've moved a lot of their recovery-oriented webinars online as well. There's also, I would recommend following both of those organizations on Twitter and Facebook, because they're often connected to other ones. There's a ton of resources for LGBTQ plus folks. Often those are easy enough in terms of like a Google search, but I'd also recommend the Sidron Institute. Actually, it's staffed by TRIP students who help connect folks who need a trauma-informed provider or trauma-informed groups, etc. So emailing help@sidron.org can hook people up to those different resources. Honestly, everything's online right now. There's that. I'll obviously put in a plug for our study if you're not currently in therapy, peersformenshealthstudy.com. So join, free 6-week session, plus you get paid to do some assessments for us. So cool deal. You walk out with free group and money. I love it. So, yeah.
So last question, and this may be a bit reductive, but if you could boil all of this down to just one thing you wish people would know or understand about this subject, what would it be?
It's pervasive. It's far more common. And if you're going to do one thing, approach everyone through a trauma-informed lens. What that means is assume everyone has trauma. Assume that nobody is being malicious in how they act. Assume that nobody is purposefully doing the things that they are doing. Be compassionate and be genuine. We are all literally suffering through the pandemic, and for some of us, this may have reignited some old traumas. So be compassionate, be non-judgmental, and understand that this is a much larger problem than I think any of us are really even aware of right now.
Great. Well, Dr. Amy Ellis, thank you so much for participating in this Shark Chat and sharing all of this important information. And hope to follow up with you at some point in the future about it.
Thank you so much for having me, Chris. It was a pleasure.